So the question is this: how do we get better, more informed patients and run successful businesses? How can I get the information I've learned from opening multiple dental offices and treating thousands of patients out to you? Those are the questions, and my weekly videos will give you the answers. My name is Dr. Nate, and welcome to the Thrive Dental and Orthodontics channel. Alright guys, Dr. Nate here again. So let's talk to you about everything dental tooth extractions. Let's talk about how much they cost, where you can get them, why you need them, anything extraction related. So let's start off with number one. What is an extraction? I mean, that's pretty simple. You're taking the tooth out. Yeah, I think everybody knows what that is. A dental extraction, you're taking out a tooth from the mouth. Boom, pretty darn easy. The other explanations of other dental procedures are harder. That is pretty darn easy. So there's basically kind of two main types of extractions. There's a simple and a surgical. What the heck is the difference? Simple is simple. So if you're getting an orthodontic treatment, potentially you need a tooth taken out. Sometimes we'll take out that tooth, and most of the time if the tooth is visible, pretty simple, pretty easy, it is a simple extraction. If the tooth is a little bit more difficult, and I'm sure you can guess which tooth is probably the most common to get surgically extracted, wisdom teeth. Wisdom teeth are tough, you can't really see them. Maybe they're covered by bone, maybe they're covered by gum tissue. The dentist is gonna have to go in there and drill it out a little bit. That is very, very likely a surgical extraction. Why do you need that tooth taken out? Well, there's a lot of different reasons. Number one, we already talked about a wisdom tooth. Wisdom tooth's not coming in good, you likely need to take it out. If you have a large cavity, you may need to take it out. And this surprises me that not everybody knows this, is that if the cavity gets too big, a lot of times cannot restore it. What that means is if the cavity gets too big, you can't just prep it, maybe do a root canal, put a crown on there. If it's too big, there's not enough tooth structure left, you have to take the tooth out. The other thing is you may need to take the tooth out if you have periodontal disease, or if the gum level or bone level is too far low. Potentially also if you have a fracture, get hit in the face, smashed in the face, you may need to get that tooth taken out. So there's a lot of different reasons that you may need to get that tooth taken out. What about wisdom teeth? Do all wisdom teeth need to get extracted? And maybe not. Some of the times the wisdom tooth is coming in crooked or coming in impacted, and we say most of the time you need to take those things out, but you're like, hey, I can't feel it, it doesn't really hurt, it's under the bone, whatever, who cares? Do I need to take it out? And the answer is yes, of course you need to take it out. And why? Because what happens is that tooth, it starts pushing into that second molar. So the wisdom tooth, we call it a third molar, and it starts pushing into that second molar, and what it does is it causes all these issues. It hurts, and sometimes it will degrade that second molar. So if you do not take out the wisdom tooth, there's a very good chance that you have to then in the future take out that wisdom tooth and also take out that second molar. And if you do not get an implant or something in that area, that means you're gonna have to do the same thing for the top two teeth. So think about that. Instead of taking out one or two teeth, one or two wisdom teeth, now you're gonna potentially have to take out 4 teeth. So there's a big, big difference, and that is why we tell everybody if the tooth is coming in impacted and the extraction is not gonna be too complicated, we recommend getting those wisdom teeth taken out. So you're like, Dr. Nate, I know I need a dental extraction. I know I need to take that tooth out. How much is it gonna cost me? That depends on your dental insurances. Some insurances are absolutely amazing and they may pay the full amount. And some insurances suck and they basically pay nothing, or maybe you don't even have insurance. So if you need a simple extraction, that can cost anywhere from maybe like $120 to $300 depending on the area, depending on how difficult it is. If it is a surgical extraction, probably add $100 to $150 per tooth, depending again on how difficult it is. You also may want to add bone graft to that. Bone graft is going to be a couple $100-ish depending on the area. And if you've seen my previous videos, maybe on implants or missing teeth, that getting that bone graft is very, very, very important if you're gonna restore that area later. Because you think if you take out that tooth, the bone collapses in that area. What bone graft does is it basically maintains the width and the height of that bone. So if you wanna put an implant or bridge or anything in that area, you can. If you do not put that bone graft in, the bone collapses. Imagine trying to put an implant into that. I gave the story this last time. It's like if you're trying to screw something into a piece of wood that's like this big, the screws are gonna come out the sides. But if you have a big piece of wood like this and you screw something in there, easy peasy. It's the same thing in your mouth. If you don't put that bone graft in, bone shrinks, you cannot really put an implant in there. There's procedures you can do to help, but it's tough. If you keep the bone graft in there, you keep the width in there, there's a very good chance that you can put a nice little implant in there later. What type of medication are you gonna need after your dental extraction? And this may seem a little weird, but it's been proven time and time again in paper that ibuprofen is actually the best painkiller. They're gonna give you maybe 400 to 800 milligrams of ibuprofen, which is a lot. So you gotta make sure that you don't have any blood issues, maybe any other issues that your medical provider does not want you to take ibuprofen for. But ibuprofen in general is the best for preventing any severe discomfort. We don't prescribe opioids as much anymore because the epidemic has just gotten so crazy. It's really sad. So we don't prescribe them as much anymore. There's also all these constraints upon dentists and medical professionals to not prescribe opioids just because it is honestly, it's killing so many people. We try not to prescribe opioids as much because we know that the opioid epidemic has just gotten so crazy. But either way, ibuprofen is going to be your best option. Of course, if your pain is unbelievable, then they may prescribe something else, but we try our best to avoid the use of opioids. All right, so you're thinking of getting that extraction, you know the cost, you know you need it. What are your options for sedation? Everybody is different. For me, I had crazy wisdom teeth and I just had local anesthesia, and that is it. That is the safest option. But if you are nervous to come to the dentist, there are a couple other options. Option number one, nitrous or laughing gas. That is a great tool for anybody. What it does is it basically makes you feel kind of loopy, but it's very fast acting and very fast to get off of it. So basically within minutes of you getting off of it, you have oxygen and you're back to normal. So that is one, makes it pretty easy. There's another type of sedation, a mild sedation, where they're gonna give you a pill, potentially the night before and the morning of. And same thing, it just makes you feel nice and relaxed. You can definitely, you're aware of everything, you're conscious about everything, but you just feel a little bit more relaxed. And if that isn't quite good enough for you, you can potentially do IV sedation. IV sedation, typically there's a dental anesthesiologist that comes in. They monitor everything because it's starting to get a little bit more dangerous. They will put an IV in, and that is when you knock out and you don't really feel or hear or see anything. And when you come to, boom, everything is done. So that is the best for the people who are super nervous about it, but that is by far the most expensive option. Most of the time, that's gonna run you a few $100s, sometimes maybe $500, $600, $700, $800 to have that IV sedation, but it is potentially the most comfortable. So you've had that extraction, you know everything that's going on, you've been through everything already. How are you gonna make sure that your teeth stay okay, your gums stay okay? So you wanna basically take it easy for a few days. You don't wanna do any vigorous activities. You do not wanna eat anything super sticky or super sharp, and you don't wanna suck out of a straw or anything that's gonna create any suction, because you can get the dreaded dry socket. And dry socket is terrible, and that is when you have a blood clot, but because something happened, you disturb the blood clot actually came out of the mouth, and that leaves everything exposed. That leaves the nerve, the bone, everything exposed. So there's a ton of pain, and most of the time you have to come back in, we have to put all this medication in there, rinse it out, make sure it's nice and pretty, but they'll still be a little bit uncomfortable for a couple days. So do not do that. Have a blood clot in there. You want to make sure that blood clot stays in there. So just take it easy for a couple days. There you have it. You know all about dental extractions. You know how much it's going to cost. You know who needs it, why you need it. You know who's potentially a bad candidate. You know who's going to be a good candidate. You know what to do afterwards. You know, just to basically just take it easy afterwards. Don't do anything crazy. That is all things dental extractions. As you know, I'm trying to put out videos every single week. I'm answering all your questions. So please subscribe below. If you have any questions or comments or videos you want me to do, please let me know in the comments below. And I will see you guys next time.